Respected President Suresh sir, other senior members of Kannur IMA and my dear friends. Association matter പ്രധാനമായിട്ട് പറയാൻ നമ്മുടെ സയന്റിഫിക് കമ്മിറ്റി വളരെ നല്ല രീതിയിൽ മുന്നോട്ട് പോകുന്നുണ്ട്. ഡോക്ടർ മനു മാത്യൂസിന്റെ ഒക്കെ നേതൃത്വത്തിൽ ഇന്നിപ്പോ ഒരു സയന്റിഫിക് കമ്മിറ്റി മീറ്റിംഗ് കൂടിയിട്ടുണ്ട്. അടുത്ത 2 മാസത്തേക്കുള്ള പ്രോഗ്രാം ഒക്കെ അവർ ചാർട്ട് ചെയ്തിട്ടുണ്ട്. സ്പെഷ്യൽ ഡേയ്സ് എല്ലാം സെലിബ്രേറ്റ് ചെയ്യാനുള്ള അഭിപ്രായങ്ങൾ മുന്നോട്ട് വന്നിട്ടുണ്ട്. അതുപോലെ നമ്മുടെ ഒരു സ്പോർട്സ് കമ്മിറ്റി രൂപീകരിച്ചിട്ടുണ്ട്. അവര് വേൾഡ് ഡയബറ്റിസ് ഡേക്ക് ഒരു ഫുട്ബോൾ ടൂർണമെന്റ് ഒക്കെ നടത്താനുള്ള പ്ലാൻ ഉണ്ട്. കണ്ണൂരിലെ പ്രധാനപ്പെട്ട ഹോസ്പിറ്റലുകളൊക്കെ ഓരോ ടീമൊക്കെ ഉണ്ടാക്കിയിട്ട് അതിന്റെ ഡീറ്റെയിൽസ് അറിയിക്കുന്നതാണ്. പിന്നെ ഉള്ളത് നവംബർ 12-13 സ്റ്റേറ്റ് കോൺഫറൻസ് നടക്കുന്നത് കുന്നംകുളത്ത്. നമ്മുടെ പാർട്ടിസിപ്പേഷൻ വളരെ കുറവാണ്. പരമാവധി ആൾക്കാരെ പങ്കെടുപ്പിക്കണമെന്ന് സ്റ്റേറ്റിൽ നിന്നൊരു നിർദ്ദേശം വന്നിട്ടുണ്ട്. അപ്പൊ പങ്കെടുക്കുന്ന ആൾക്കാർ ആരൊക്കെ ഉണ്ട്, നമുക്ക് വേണമെങ്കിൽ ഒന്നിച്ചൊരു ട്രെയിൻ ടിക്കറ്റ് ബുക്ക് ചെയ്യോ അല്ലെങ്കിൽ ഒരു വണ്ടി അറേഞ്ച് ചെയ്യുകയോ ചെയ്യാം. പങ്കെടുക്കാൻ താല്പര്യമുള്ളവരൊന്ന് അറിയിച്ചാലും നന്നായിരിക്കും. ഇത്രയാണ് അസോസിയേഷൻ മാരിൽ പറയാനുള്ളത്.
Hello. So after COVID, then came rabies. Now the WhatsApp is dominated by drugs. You will see a lot of skits and advertisement and children taking drugs and warning regarding these children. I mean, how we need to identify them early. Okay. So Dr. Vinayak will be talking on this hot topic, the newer drugs of abuse. And Dr. Vinayak is a consulting psychiatrist practicing at CIMHANS, Kuthuparamba. It's a 100-bed dedicated facility for catering psychiatric patients. He did MBBS from KS Hegde Medical Academy in 2010 and MD Psychiatry from Kannur Medical College in 2017. He is also holding a DNB degree from a National Board of Examination. His special areas of interest includes child and adolescent psychiatry, community psychiatry, and he is IPP of IMA Kuthuparamba. And he also represents the district representative of IMA PEPS. Currently serving as president of Kannur Psychiatric Guild, a branch of Indian Psychiatric Society at Kerala State. I welcome Dr. Vinayak to deliver the talk.
Thank you. Good evening, everybody. At the outset, I would like to thank the office bearers of IMA Kuthuparamba, IMA Kannur for having given me this opportunity to be here today amongst all you senior doctors, many doyens of IMA Kerala State Branch. Today, I've been given the duty of talking about newer drugs of abuse. What is the need for this topic at this moment? If you like it was told here earlier, we have come past COVID, then rabies. But if you look at all along, there has been a silent pandemic in our state, mostly among the youth. And before and all, we have children presenting to our OPD and they reveal that they've been using alcohol or they've tried alcohol or taken a puff of a cigarette, you have parents feeling very shocked and maybe emotionally distinct. But actually these days they come and they say they've tried alcohol. We are of the fact, okay, it's only alcohol, because the scene has changed so much. And if you look at it, everywhere there is awareness classes, awareness. For example, last 10th October was Mental Health Day, and everyone was focusing on drug abuse. And in our Kannur district itself, under our Kannur Psychiatric Guild, we had around 4 flash mobs at different places, classes and everything. So everyone is focusing on this. There are classes happening in schools and other educational institutions on a daily basis. The focus is on students, on teachers, on parents, on the community level, the leaders of the local self-government and everyone. But somewhere down the line, we feel that the people who are not aware of the newer drugs of abuse are us doctors itself. Because when we have a patient coming to us describing what he's gone through and what he's using, sometimes me as a psychiatrist itself has been stunned and have not had answers. Like just a few weeks ago, I had a patient who came and there was a lot of behavioral changes noticed in him. And while talking, he was very confident. He was telling, and he just told me that he used ice. I'm like, ice, okay, no problem, ice. And I just let it go. And later, when his urine drug screen results had come and it was positive for amphetamine, and that's when I read up and I found out that ice is a street name of methamphetamine. And so that's how these children talk, and that's how they communicate. And when we are not able to match up to these things, we feel a little short in front of them, which should not be the case. So today I'll be talking about newer drugs of abuse. What are the newer drugs of abuse? I'll be focusing on a few drugs over the past next 25 minutes to 30 minutes. I have not touched on alcohol, which you all know is a usual old drug, and even opioids, which has been in the market and in the community for a long time, though opioids not very common in our state. We go ahead, we need to realize that addiction is a brain disease. It's not just only a behavior or anything. There are changes in the brain seen in people with addiction. And addiction could be not only to substances. It could be to substances like depressants, stimulants, hallucinogens. It will also be to behaviors, pathological gambling, internet use, gaming, sex, exercise, shopping. Anything in excess could lead to addiction. And more so in our present community, mobile addiction among children has been on the rise. But in all these, why do people use drugs and end up in this addiction? We need to realize that whether it's drugs or any addictive behaviors, they target the dopamine reward circuit of the ventral tegmental area, prefrontal cortex, going through the nucleus accumbens. So there is a scientific evidence behind addiction and why people on their own is not able to get off these addictions. When we make a diagnosis of a dependence of alcohol or anything else, we need to have a criteria so that there is a level playing field among everyone who makes a diagnosis. There should be 3 or more of the following together at some time during the previous year. It could be a strong desire or sense of compulsion to use the substance or continue the behavior. That's called craving. It could be a difficulty in controlling the behavior or use of substances. It's a loss of control. There could be a particular withdrawal state. When you suddenly stop using the substance, the person would experience certain physiological and psychological phenomena, which could be particular or for that substance. There would be tolerance as in you start with an amount of substance which gives you a high, and over time that same substance would not give you a high. You would need a larger quantity of the substance to give you the same high. And there could be salience, where the socio-occupational functioning takes a kick, and also use despite the evidence of harmful nature. So out of these 6, any 3 over the year, we can make a diagnosis of dependence for the substance. Before I go ahead, how do people use these substances? They could smoke, like you see in cigarettes and all that. It could be taken parenterally through injections. It could be ingestion, like alcohol and everything. And it could be intranasal or snorting, where there are few substances. The newer substance of abuse, which I'll be discussing today, have been broadly classified as stimulants, hallucinogens, inhalants, cannabis, and benzodiazepines. Stimulate the class drug and stimulants make a person awake, alert, confident, and energetic. There are a lot of stimulants. Caffeine, in fact, caffeine is the most abused drug in the world. We all actually are kind of addicted to caffeine. Nicotine, another common drug. These two are stimulants. If you go by experience, you have a coffee, you feel awake, you feel alert. So that is a stimulant. The other abused drugs among stimulants include amphetamines, MDMA, and cocaine. I would be focusing on amphetamines, MDMA, and cocaine. Methamphetamine was developed in the 20th century from its parent drug amphetamine. It was originally used in nasal decongestants and bronchial inhalers. It could be available as methamphetamines, and the street names of them include speed, meth, or crank. And crystallized methamphetamine is also known as ice, like I told you earlier, crystal or glass, and is a smokable, and the crystallized form is more powerful in bringing out its effects. Amphetamines could be used inhaled, it could be smoked, it could be swallowed in a pill form, it could be snorted, or it could be injected when dissolved in water or alcohol. The amphetamines, they cause euphoria, they can cause irritability, confusion, tremors, anxiety and paranoia, or violent outbursts. It could increase the heart rate and blood pressure, increase wakefulness, insomnia, and increase the physical activity. It could decrease appetite and cause sometimes extreme anorexia needing medical attention, respiratory problems, possible irreversible damage to blood vessels in the brain producing strokes. Methamphetamine users who inject the drug and share needles are at higher risk of HIV and AIDS. It could cause hypothermia, convulsions, cardiovascular problems, which can even lead to death. MDMA, they are available as MDMA is a very commonly used drug of abuse in today's world, especially after the lockdown during the COVID pandemic. There has been an upsurge, a sudden upsurge of MDMA availability in the black market, and especially among the youth. If you look at our hospital itself, we have a drug urine screening kit because we have a lot of children coming with unexplained behavioral outbursts, changes in behavior, sudden changes in behavior, which cannot be explained by usual psychiatric this thing. And they naturally don't come and tell us what they've used. They tell, no, we are not used to it. So we need a way to actually find out if they've been using something. So many children, if you look at vaguely, if I carry out 10 urine screen tests on children on a day, probably at least 5 or 6 in today's OPD would be amphetamine positive. It's actually, in a way, it's become even more common than cannabis in today's market. Amphetamine is very freely, especially MDMA is very freely available. It could be available as tablets, the capsules. It can be, it's called MDMA. Just rearranging those letters, some people call it Adam, ecstasy, XTC, and they could, and the things available in the market need not always be pure MDMA. It could have other active ingredients also, which could pose other dangers. It could sometimes contain caffeine, dextromethorphan, ephedrine, cocaine, and all these could be mixed with MDMA and is available, and those could pose even other dangers. Cost, it's very costly. Of late, there has been the exact cost, I'm not sure, but probably in the thousands for sure. Not one shot. They come in grams. Comes in grams. No, some comes in tablets. Most of the things available here are in the crystalline form. Some there are tablets also available. MDMA could be used. The oral form like pills and capsule, intranasal, they could inhale bumps, they could powder it and make it bumps and inhale it from the back of the hand. And they could also use other paraphernalia like spoons and pen caps. Not in India, but in the South American countries, there's a lot of booty bumping where the MDMA is made into the liquid form and using a syringe is injected into the anal opening so that there's a immediate effect of it. It could come with a lot of dangers too. If you look at the Western literature websites, drug abuse websites, there are actually to bring about awareness in people doing booty bumping. When I was just doing the reading yesterday, there are so many sites that come about with the actual scientific steps how you can do booty bumping. And one of this thing, you keep an antidote in hand so that if something happens, you can always take it, because sometimes the overdose could be sudden. Physiological effects of MDMA could include a loss of appetite, nausea, muscle aches, tachycardia, hypothermia, other cardiological complications, and liver damage. Psychological effects, just like in amphetamines, euphoria, anxiety, depression, and panic attacks, depersonalization, paranoia, psychotic experiences, and cognitive deficiencies, memory loss, and decreased planning ability. MDMA basically alters the brain chemistry. It acts on the serotonergic pathways, increasing the amount of serotonin available in the synaptic cleft. And sometimes overuse can lead to a serotonin syndrome characterized by hyperactivity, confusion, agitation, hyperreflexia, hypothermia, tachycardia, shivering, myoclonus, ocular oscillations, and tremor. Rare severe side effects could include, like I said, severe hypothermia, rhabdomyolysis, DIC, multi-organ failure, seizures, or intracranial bleeds, or even death. Rhabdomyolysis is a very rare but a very severe complication of excessive MDMA use. Next stimulant I'll be discussing is cocaine. Like you all know, it's available in this powdered form. It can be snorted, it can be smoked, it can be injected. Snorting is the most common way of use, where you make a line of the powder and usually in the West, they use a currency note rolled up and you take it intranasally. These are some of the instruments used for snorting. The duration of effect, when it's injected, the effect lasts for around 3 minutes. By smoking, the effects last for around 5 to 10 minutes. And by snorting, you got a longer effect. It lasts for around 15 to 30 minutes. And once the drug leaves the brain, users sometimes experience a coke crash, what is a trigger of depression, irritability, and fatigue. It can increase the heart rate. It can constrict blood vessels in the brain, causing strokes. Cocaine can cause seizures and lead to bizarre or sudden outbursts of violent behavior. And snorting always very commonly causes nasal injuries, in damages to the nose and sinuses, and also can act as an irritant of the lungs and cause sometimes permanent lung damage. Although cocaine has a reputation of being an aphrodisiac, it actually may make you less able to finish what you start. Chronic cocaine use can impair, studies have shown that they impair sexual function in men and women. In men, cocaine can cause delayed or impaired ejaculation. Short-term effects include dilated pupils, increased body temperature, insomnia, lack of appetite, increased energy, reduced fatigue, mental clarity, or over-talkativeness. Long-term effects can include paranoia or psychotic symptoms, depression, ulcers in the membrane of the nose, changes in the chemistry of the brain leading to other neurological issues, dulled senses of taste and smell, weight loss, poor health and sexual dysfunction, loss of social and financial support. Use of cocaine is a costly affair. It's one of the costliest available drugs of abuse. And so that's why probably that's one of the reasons it's not very common in so common in India, because it's quite costly. Injuries in the nasal membranes can be because of repeated snorting. Other signs of cocaine addiction: teeth grinding, dry mouth, dilated pupils, rapid speech, nose bleeds, weight loss, erratic sleep schedule, and financial issues because of the cost. That's the stimulants that I talked about. Next, I'll be discussing about hallucinogens. The two most commonly available hallucinogens are LSD and psilocybin. Hallucinogens are a class of drugs that causes the user to experience hallucinations, which is a perceptual abnormality. It could be auditory hallucinations, it could be visual hallucinations. And they make the patient get out of touch with reality. They are also known as psychedelic drugs, and they could be natural or synthetic. LSD is D-lysergic acid diethylamide. It's derived from a parasitic fungus that grows on rye. It's produced as crystal, then dissolved in alcohol prior to sale and consumption. It's sold under diverse street names, which include acid, blotter, doses, dots, strips, etc. It could be used in a pill form. It could be used in a piece of blotter paper. Sometimes it's used as a liquid, which is directly dipped to the tongue or into a sugar cube, and the sugar cube consumed. These are stamps. It's available as stamps most commonly in the Indian markets, and the stamp is, each stamp is taken and placed on the tongue. Following ingestion, the drug's effects could be felt for almost 4 to 8 hours, and where you would be experiencing various effects of LSD. Psilocybin is another hallucinogen. It's more commonly known as magic mushrooms. The magic mushrooms could be, those are mushrooms which cause hallucinations. They could be eaten. They are usually dried prior to being sold, and consumption could be, they could be eaten raw or cooked like regular mushrooms. It could be drank. Many people heat it with water to make a tea or a soup of magic mushrooms. Sometimes smoked. It's grinded, made into a powder, and often mixed with marijuana and smoke. Physical effects of hallucinogens include dilated pupils, increased body temperature, increased heart rate, increased blood pressure, extreme sweating, and usually a loss of appetite. Psychological effects could include vivid hallucinations. It could be auditory, visual hallucinations most commonly, a loss of depth perception, a sensation of floating, loss of thought process control, fusion of the senses, distorted perception of time, and bad trips. Usually they get you out of touch with reality. And when you use it, it lasts for around 4 to 8 hours. And flashbacks are a common occurrences in with the use of hallucinogens, where it's a long-term side effect of hallucinogen use, where a spontaneous or unpredictable sudden recurrence of the effect of hallucinogens, even when you're not using the drugs. Even when you're not on the drugs, you would be experiencing the same effects that you actually experienced with the use of a drug. It's a long-term side effect of use of hallucinogens. The flashbacks could be emotional flashbacks. It could be somatic, multiple somatic complaints, and most commonly perceptual or hallucinations. You could say. The next set of drugs of abuse that I'll be talking about is inhalants. The inhalants, the peculiarity of inhalants is they are legal. They are everyday products that have a useful purpose, but then can be misused. They are breathable chemical vapors that produce mind-altering effects. Inhalants could be solvents, it could be gases, it could be nitrites, it could be common household products, glue or Fevicol, which is very common among school-going students, spray paint, air fresheners, fabric protectors, most commonly nail polish removers, paint thinner. There are some kids who also use these whitener inks, whitener materials, and also petrol. Some people use diesel petrol to inhale and get a high. It's actually it's been there for a long while, used among in hostels and among children, and certain reports in 2019 said that 30 lakh children, almost 30 lakh children across India are addicted to inhalants. And why are they so popular? Because they are easy to obtain, and the kick is achieved instantly and lasts for 5 to 15 minutes. They're easy to conceal because they are markers, correction fluids, which are commonly needed in student lives. Since inhalants are common, youths have the misperception that it's safety, like it's anyway available in the market. So there is a notion among the children that it's quite safe. Otherwise, it wouldn't be there in the market. Users can get high several times over a short period because inhalants are short acting with rapid onset. So that's one another advantage. You use it, you get the kick very high. It's a short acting, so within few minutes you would be back to normal, and they can repeatedly use it. And it's attractive to children who usually don't like a delayed gratification. They want all the highs fast. So children, it's very common in schools and hostels and everywhere. Inhalants could be sniffed by inhaling the vapors from an open container or from a heated pan. They could be huffed. Huffing is how you're concealing the volatile liquid in a cloth and you keep it over your nose or against your face. It could be bagging, application of a little bit of the liquid into a paper of a plastic bag, and which is held over your face so that you can inhale it. People could also spray it directly into your nose or mouth, and sometimes even balloons. Inhaling substances placed inside a balloon can give you a kick. Acute effects include euphoria, most commonly a lightheadedness and sleepiness, distortion of space perception, nausea, spinning, drunkenness, an altered sensation of colors, dizziness, and numbness. Undesirable effects also come in the form of slowed breathing, slowed heart rate, occasionally disorientation, and loss of body control. Long-term effects of use of inhalants could be chronic memory loss, emotional instability, slurred speech, body tremors, and visual disorders. Long-term effects could also include psychological effects like personality changes, changes in memory, and also sometimes perceptual or hallucinations and learning difficulties. A loss of coordination, slurred speech, chronic tremors, and uncontrollable shaking can also be seen. Serious visual disorders are also common with the use of inhalants. It sometimes comes with, there are many cases where death has been reported with the use of inhalants, and that could be due to various causes other than just the direct effect of inhalants. It could be because of suffocation or choking when someone falls unconscious. It could be because of asphyxiation because there's a decrease in oxygen, especially when you're using a plastic bag held over your mouth. It could be fatal injuries from accidents and other motor vehicle fatalities suffered when someone is intoxicated. And there's something called a sudden sniffing death, where a prolonged session of inhalation leading to heart failure, and can happen given any given time. Suddenly, it could lead to a cardiac arrest. Withdrawal symptoms. The use of inhalants comes with particular withdrawal symptoms include tremors, irritability, insomnia, sometimes a disorientation and delirium, tingling sensations, seizures, muscle cramps, and anxiety. And these usually arise a few hours and sometimes even a few days after inhalant use. Signs of inhalant use: when you have children with paint stains or in the body or clothing, spots or sores around the mouth, red eyes or running nose, the breath odor of chemicals, when they feel drunk, dazed, or dizzy, nausea, loss of appetite, anxiety, excitability, irritability. They are inhalants. Coming to the pharmacodynamics, are liquid, so they result in breakdown of the myelin sheath of neurons and lead to faulty nerve transmission. Reversible effects could be liver and kidney damages, especially in toluene, depending on the content of the inhalants used, and also because of blood oxygen depletion. There could be also irreversible damages. There could be permanent hearing loss with the use of certain inhalants. There could be peripheral neuropathies or limb spasms with the use of central nervous system or brain damage, and sometimes even bone marrow damage, mostly seen with excessive or prolonged inhalant use. The next abuse is probably what we have most heard of after alcohol, and it's quite common. It's quite common, as in it's very common in today's world, especially after the lockdown and the pandemic. There has somewhere been a paradigm shift where sometimes probably when alcohol was not available, a lot of people have shifted to regular use of cannabis. Certain Delhi is in fact the third on the list of 120 cities in the world in terms of weed consumption. Mumbai is sixth. So in the top 10, we in India have two. 31 million Indians consumed cannabis in 2018, of which 13 million used weed and hash. 7.2 million were problem users, 2.5 million dependent users. New Delhi, as in India, could raise up to 725 crore a year if cannabis was taxed the same rate as cigarettes. This is the cannabis sativa plant, the leaves of which is used. Cannabis is used as many ways. It could be hashish or hash, it's commonly called, which is hard, which is made from the separation of trichomes from the cultivated plant. It could be also used as charas, which is the resin from the plant. Ganja is, after taking the resin, the flowery or fruiting tops of the cannabis plant. And bhang, which is very commonly used, especially in South India, where the leaves are crushed, made into a paste and mixed with milk. If anyone's been to Mangalore, we have a car street festival happen every year in Mangalore. And during this festival, it's very commonly available. Openly, everyone will be drinking bhang, which is actually cannabis. This is hashish, hash, charas, the raisins. These are all usually powdered and smoked. This is the normal ganja. This is the paste, which is then mixed with milk and used as bhang. Common. These are the seeds, which can also be used. So cannabis can be used, like I said, ganja, which the price. This is just an article which shows the price. It can be used as charas or hashish. It can be used as bhang. And if you go to the Western world, especially in Amsterdam and certain areas where for a long years marijuana has been legal. Marijuana is available as marijuana muffins, which are cakes. There are cannabis pizza sauces which can be used. You can use it in Amsterdam. You can't carry it out of Amsterdam. That's the rule. And even I've had cannabis was used. They've actually closed down that also. I think it was sent for analysis to find out. Someone had made a listing that there was some cannabis extracts used in the milkshake, one of the particular milkshakes given there, and many kids were using it. And so I don't know what, I didn't follow it after that, but there was an investigation which was initiated. Yeah. Yes, sir. And cannabis, there are certain forms of cannabis depending on where it is grown. Like in India, you have Malana cream, which is from the eastern mountains. There is a Mysore mango, which is a specialty of the cannabis got in Mysore, and it's called Mysore mango because it comes with a mango smell. Then there is super cream, there's golden weed, Manipuri weed, and in fact we have our own in Kerala, Idiki Gold, which is actually the family of cannabis which has been bought directly from Amsterdam and cultivated in Idiki district of Kerala, and it's one of the most sought after cannabis variety in India. It comes around Idiki Gold in Delhi. If you want to buy Idiki Gold in Delhi, around 10 grams costs around 2,500 rupees. And that's our own Kerala's contribution to the cannabis collection. Cannabis could be smoked. The effects when smoked starts in 1 to 2 minutes and ends in 4 hours. Perorally, taken as bhang or anything, it starts in 30 minutes and it lasts up to 6 hours. Cannabinoid receptors are placed in many areas of the brain, and that's why cannabis comes with a variety of effects, be it its actions on hypothalamus and thereby affecting the appetite. Usually cannabis eaters have a voracious appetite. You use cannabis, you feel hungry and you feel like eating a lot. Cognitive functions because of its effect on neocortex, memory issues because of its effect on hippocampus, cerebellum, and like that, cannabinoid receptors are widely placed in various areas of the brain. Bodily effects of cannabis, there would be reddening of the eyes, decreased intraocular pressure, dryness of mouth, sensation of heat or cold, increased heart rate, and you feel a relaxation of the muscles. Short-term effects could be relaxation to sedation, bloodshot eyes, coughing, lung irritation, some pain control, increase in appetite, loss in muscular coordination, and decreased blood pressure. Could also lead to increased heart rate, increased blood flow through the mucous membranes of the eye, and impact tracking ability. Short-term effects in the psychological effects with mild to moderate use could be confusion, feeling of deja vu, drowsiness, feeling of detachment and being aloof, difficulty in concentrating, and disruption in short-term memory. Short-term effects with heavy dose could include stimulation, giddiness, distortions of color, time, and sound. Short-term effects with very heavy dose could include feelings of movement, visual hallucinations, auditory hallucinations. We have seen psychotic and patients having and displaying core psychiatric symptoms with even one use of cannabis. Single use can lead to this. In fact, we just remembering around 2-3 months back, we had a 16-year-old girl present in our OPD with a sudden onset of behavioral change. No family history, no prior history. There is no other thing to look at why she would develop these symptoms. 16-year-old girl from school, and we probe, there was nothing, and few days history of behavioral change. We usually run a drug screen kit, and we got it cannabis positive, and she was positive for cannabis. A girl, 16-year-old girl, who's the parents couldn't believe. They're like, no, she's not used. She's also like, I've not used. And we also tend to believe that, okay, she doesn't look like someone who uses cannabis, but the urine screen was positive for cannabis. And then we probe, and that's when she told that she had around 2 weeks back, she had shoulder pain, for which she consulted an Ayurvedic physician who gave her certain medications and for pain relief. And she's been diligently taking those tablets over the last 2 weeks. And we asked them to get a pack or show us the medications, and this is what she showed. Cannapain. It's made in India. There's cannapain and there's cannaflam. These are wholesome cannabinoid extracts readily available. You want cannapain, you can just go to one of the online websites that sell drugs, and you can buy it. It's very commonly available in, there are a lot of people that when I heard this, I had actually called up one of my friends in Bangalore, and they were like, it's very common here. Every students are in Ayurvedic physicians telling they have shoulder pain, leg pain, so that they can get this. There are cannapain tablets and even inflammatory cannaflame, and these are made in India, sold in India. It's freely. You don't need a prescription. You can go to any of the online websites and have that. And that 16-year-old girl was taking this, and she had these psychiatric symptoms. So that is over the years probably become more acceptable, and mainly because there are a lot of misleading comments, especially coming from even experts regarding cannabis. Withdrawal symptoms, though it's usually said that cannabis comes without withdrawal symptoms, but heavy users do experience withdrawal symptoms, which usually begins 1 to 2 days after stopping and peaks in 2 to 4 days and lasts for 1 to 3 weeks. Withdrawal symptoms could most commonly seen as irritability, anger, or sudden surge of anxiety, sleep difficulties, decreased appetite, decreased mood, physical symptoms, gastric pain, tremor, headaches, fever, chills, and sweating. Long-term side effects, because of its effect in prefrontal cortex, cerebellum, and hippocampus, impact cognition, attention, memory, problem solving, mental flexibility, and altered brain function or neuroimaging. And most of these long-term effects are likely reversed following an extended period of abstinence from the use of cannabis. There could also be respiratory problems based on its distinct irritant to lungs. It's usually smoked as joints, where you mix the florets of the ganja. Sometimes people have it directly. Sometimes people mix it with the tobacco, which is emptied from a cigarette. And there's a paper, Rizla paper, which they use, sometimes with the filter and sometimes without the filter. So most of the times it's smoked without a proper filter. So smoking 4 joints is probably equivalent to smoking a pack of cigarettes. And it can also depress the immune system. And you all know there has been a pandemic proportion of cannabis use, especially in our state. It's very common among youngsters, especially youngsters, and it's almost a very big deal. And most of the times it is sold with so many misconceptions, many false things said about cannabis. Many people say it's less harmful than cigarettes, and some people say it improves the intelligence. Some people say it's derived from plants, so it's a natural thing. Some people say most commonly used thing about use of cannabis, it's used as a medicine in USA. It's used as a medicine in medical science as itself approved that it is used as a medicine. Some people say it does not kill. Many people say it's not addictive. Some people say it improves creativity, because I've also heard stories like many directors, Hollywood, this thing they write all the I've actually heard even Christopher Nolan, who has made these Inception and all those very good crazy movies, which we find it hard to this thing. They say that he smoked cannabis while writing the story. So it also says it reduces tension. Basically, all these are false. All these are misleading comments, which should not be given any importance. And cannabis always also has a gateway effect, especially cannabis and alcohol and tobacco. And the use of cannabis and alcohol usually it starts with these, stays with these, and later leads on to more like cocaine and amphetamines and all that. Finally, I'll be talking about benzodiazepines, commonly used, commonly come across sleeping pills. It could be nitrazepams, alprazolam, diazepams, lorazepams. Sometimes commonly prescribed, but many times abused also. They could also have long-term use, could have withdrawal symptoms, their anxiety, they could cause depression, other sleep disturbances, hypersensitivity to touch and pain, tremors, and headaches, and all lot of sort of withdrawal symptoms. And rare withdrawal symptoms could also include psychosis and epileptic seizures. We all know that benzodiazepines are also anti-epileptics, so sudden withdrawal can also lead to seizures. Basically, that was the newer drugs of abuse that I discussed. Just to break through, there were stimulants, there were hallucinogens, there is inhalants, cannabis, and benzodiazepines. If I go into the treatment of it, it would probably take much more things. So I did not focus on that. I was just so that we all are aware of what are the available drugs in the market, what are the drugs that somewhere when we have a diagnosis where nothing fits into the bill, we need to think about, okay, probably it is because of a drug use. When you briefly, if I go into the treatment, there are multiple stages. You need to first evaluate, get an idea about what are the drugs being used, get an idea about what are the probable withdrawal symptoms that we could encounter with the specific patient. Mostly we would require an IP treatment. IP treatment mostly for evaluation to evaluation and treating the withdrawal symptoms. Also in a safe facility, a safe IP facility, even though there is craving, we can ensure that the patient does not have access to the drugs. And also following the detoxification, we initially do a detoxification to counter the withdrawal symptoms, and following that you could have psychotherapeutic, psychological interventions, motivational enhancement training. Basically, stopping drugs is not only through medications. Medications help to prevent withdrawal, medications help in controlling craving, medications help in countering other psychological effects which could have led to the substance use. But it's all based on the motivation of the client. If he wants to stop, he will. Otherwise, in spite of all these medications, if he wants to continue, he will continue. So motivation is probably a very, very important factor in someone who wishes to discontinue substance use. And there are many ways, psychological interventions, which can improve motivation. So we need to put that into action before we come to a prognosis. Thank you.
Thank you for the law is open for discussion.
One question. From what age children you should teach them there could be drugs in the school, beware, etc., like some education?
There's no actual hard criteria when you should start. It changes. Like in the past, when drugs were not very commonly used, we used the focus was always probably post 10 standards. But now the scene has changed. There is no criteria as such. We have people very young age who are exposed to this drugs. So what has changed is the availability. Before we could ensure the availability was not there among the very young. Now it's so freely available. Even people 13, 14, 15 years they get cancer. They right there. At least there are certain people, children with ADHD or impulsive. They actually have a higher risk of crying. So, if you ask me, when do we do an intervention? That's possible. And if able to make a decision also, especially we can actually probably at home. The talk about these and the harmful effects should be started at home. For that, we should ensure that the caretakers, parents, teachers are aware of what forms this drug therapy. See, for example, someone coming to a class and sniffing on Fevicol, they would understand yes, Fevicol. But if we have someone who is there who can understand that is that the way you can actually what happens in today's world is today's society is once you realize that it's used or is dependent, is stigmatized at that point. Okay, he's a drug user, and whatever he does, he's a drug user. Even if he comes for treatment and is talking about he's a drug user. So we should not stigmatize them. Probably make them understand that there is a way. Once you start using and once you defend it, stopping it is not completely up to him because there are changes in the brain, like I said, which makes him continue with it. So instead of stigmatizing them, if you make them understand, give him the required help, probably the patient himself would be thankful when he comes to it. So, like your question, at what age? Could be at any early age because the scene right now is so freely available. And yes.
ഞാൻ MBBS പഠിക്കുന്ന സമയത്ത് നിങ്ങൾ പറഞ്ഞ പോലെ പലരും പിന്നെ പിന്നെ അത് ഗഞ്ചാവിനെ പിന്നെ പലതരത്തിൽ ഇതെല്ലാം ഞാൻ ആ സമയത്ത് വളരെ കോമൺ ആയിരുന്നു when I was after my house residency, I was staying in a school. There, these people used to buy the LPG. These people used to come and they'll be having this ganja. And near crowds, it's famous people get the ganja at that time. Then regarding now, the Gujarat during Holi, I think. Holi is under the Tamil ഈ ഹിമാലയത്തിൽ പോകുമ്പോൾ ഉത്തരാഖണ്ഡ് ഫുള്ള് ഔട്ട്സൈഡ് ഫുള്ള് തന്നെ ഞാൻ നമ്മൾ അതിലൂടെ പോവാം കാട് കൊണ്ടിരിക്കുന്ന ഫുള്ളായിട്ട് അവിടുത്തെ ലേഡീസ് household job is to take it and let it and they will do like this and they will make the ganja and essence also. But they are going to 25% of kg. This is every cow ganja is even illegal government outside this destroys ganja plants. Again, we try to publish up some so it's very difficult to control this. Maybe it's a part of in the medical college, it's stress, exams, stress. അതാണ് അവരുടെ ഈ അധികം ഫസ്റ്റ് സ്റ്റാർട്ടിങ്
Like you said, cannabis over the years it has become a part of culture. Especially because in some Himalayan hill stations, you get Manali, you get Mussoorie and Darjeeling and all that. It's common culture.
ഞാനിങ്ങനെ നമ്മൾ ഒറ്റക്കാരി നടത്തുക ഗ്രൂപ്പായി പോകുന്നത് പലപ്പോഴും അപ്പൊ ഈ സ്വാമിമാരുണ്ടോ
The biggest dealers of cannabis in the sub-Himalayan areas are these Himalayas, Himalayas, they will be meditating and they themselves will be on.
they will invite us.
What happened is over the last 2-3 years, there has been a complete paradigm. Cannabis has become socially acceptable now. The availability of MDMA and MDMA is more harder.
Sir, regarding the management of this kind of patient, what about this, let's say, weaning from ventilator? Any criteria for weaning from the stronger to the, as you told, milder form? Just for a curiosity.
Yes, it's like I told you, addiction is physiological. There's changes in the brain. So there is a misconception that even in like cut down, or taking cut down. But one of the main criteria for it is if you're dependent, you won't be able to cut down. It's a wrong notion. Because once you're dependent, you're tolerant, you tend to use this thing. You need a medical or a psychiatric intervention to do. So that's why many people come to us and they accept they have alcohol use, they accept that they want to stop using, and they say that treatment and
No, I'm not asking about alcohol. Regarding this MDMA, very stronger thing. Whether it is possible to the dosage correction or change to some other
the problem is the other drugs also have their adverse effects. The other drugs also have their dependence factor. So it's like you said, it might be from a harder drug to a softer drug, but still a drug of abuse. So and even if we do use benzodiazepines in some people for coming from the addiction management, but it's for a short term and as fast as possible we taper it down and stop.
What I'm telling is, I had a patient with a unilateral seizure more than 2 hours. While examining, while planning to intubate, the sister found out that some gum is there between them. Then we removed that, right? It was okay. But the thing is, whether it is possible to withhold completely a sudden life and can end up with some other problem.
Yeah, we could have withdrawal symptoms. Withdrawal symptoms could be in the form of irritability, it could be.
I feel stronger than that of addiction.
Yeah, but they are treatable. They are treatable. And they're not, once you are coming over it, then your own substance would be.
What we did is, we started as a pump and then they gave the air presentation to get out. Is there a genetic predisposition to addiction?
Yes, there is a strong genetic predisposition to addiction. Especially most of the studies have focused on alcohol and genetic propensity for alcohol. There are a lot of studies focusing on specific genes, targeting genes on the genetic qualities of alcohol.
And whatever, we did a study, our Institute of Dynamics study conducted and found that around 60 to 100 genes regarding this, especially cocaine, cannabis, and alcohol. The direct genetic predisposition. If you go through this family history, you can see that father will be having this area or some other area.
The problem is there might be pathological alcoholics. Pathological alcoholics, as in you try any intervention, they will stop. You really think yes, like we have they come on their own voluntarily come get addicted. I want to stop. Go back after 2 months, relapse, come back. I want to stop. Like 10, 20 times. The pathological form of addiction is a very strong genetic.
Why is it called substance drug? Anything is a drug, anything is a substance, you know, it's a matter. So it is called the substance. Why is it name? How is name came?
Substance of abuse related short form of substance.
And substance, there is a variety of, like sir told, there is a wide variety of things that can be abused. A wide variety of things that can be abused, from common household items to very rarely available drugs. So, common term drugs, yeah, many people use drugs, but then there's an argument that
Medicine is a drug.
the medicine we prescribe are drugs which now one of the most researched aspects is digital addiction. See, mobile use, internet use, gaming, digital addictions.
The politics are addiction. There are sex addiction. So many addictions are.
There is that criteria for if anything meets that criteria, you are dependent.
That's right. But why my question is that why this particular psychoactive drugs are called drugs? But there are so many other drugs which are not psychoactive. See, cocaine, the psychoactive drugs are called drugs, and they are also called substance. Substance, literally it means from the matter. Anything is a substance. So why this particular thing is called as psychoactive drugs are called substance?
It's not just for substance. It's for substance of abuse.
Science, the naming.
So it's not actually just for substance. It's for substance of abuse. So these substances are prone to be abused, and that's why they are called substances.
So it is really to say that substance is abused, abbreviated as substance.
No, not a substance of abuse.
So it is available in different forms. Solid, plasma, liquid, vapor. So it's called substance. You cannot call it as unknown. That's why it's called a substance. And some people who are fond of smoking every day and every time when you are getting a
So yeah, I thought so this issue, the social issue, we are discussing with the police department and other people. The problem is why catching these carriers or some other persons, they are reducing the gram with that. That is the issue. I think it's a big mafia, not a question. So we should be very careful regarding that and handle this issue. Where in Udiyadu, there was a vegetable person. He used to do this game because he had a good track and he conducted some youth programs. He is a very unknown person. It's like a party.
And there is a lot of people with these antisocial personality traits who are involved in this antisocial personality traits. They always act against it or they don't care for it.
Politicians,
Yeah.
politicians,
Sometimes many people involved in these are antisocial personality people who have a bad prognosis. Like we get a lot of patients who present initially as common substance abuse. Whether they have these antisocial traits, it takes time for us to. We have had a lot of patients, and then when they realize it's antisocial people, like he starts affecting the other motivated people who are affected also. So there are people, like, for example, in our institute, there are so many antisocial people who are affected as a distance. They even now come who are pretty every day and ask for attendance videos and about to get in.
It depends on patient motivation. Usually we say motivation, but then we assess motivation and motivation. There is no hard part to so many days. It varies from institution to institution, psychiatrist. But at the end of the day, what we usually do is at the end of the day, we assess motivation. If he is motivated, we have the ability to go. If he needs an extended motivation, we continue to stay in motivation.
interesting event. Then I was the business like. So one area, you can get with another lady. He was what is the blood beat? Then I asked him, I think it's lazy brother. 45 years. I think the
It's a big argument. It's a big argument. Probably then the use might be more legalized as in make it like government facilities so that it's not children.
Youth safety recently they gave permission.
Cannabis in many states,
What is the
because it's based on individual motivation. How motivated you are at the end. So many people make it long that some people like people few years constant
Vinayak doctor പറഞ്ഞതുപോലെ കോവിഡിന് ശേഷം ശരിക്കും ഒരു സൈലന്റ് പാൻഡമിക് തന്നെയാണ് ഇപ്പോൾ ഈ ഡ്രഗ്സ്. സൈലന്റ് പാൻഡമിക് ആണ് പ്രധാനമായിട്ട്. ഹലോ, വിനായക് ഡോക്ടർ പറഞ്ഞതുപോലെ കോവിഡിന് ശേഷം ഒരു സൈലന്റ് പാൻഡമിക് ആയിട്ട് ഇപ്പോൾ ഡ്രഗ്സ് ഏകദേശം കേരളത്തിൽ വന്നുകൊണ്ടിരിക്കുക. പുതിയ MDMA നമ്മുടെ ഗവൺമെന്റ് ഒക്കെ അതിന്റെ മെഷേഴ്സ് എടുക്കുന്നുണ്ട്. കുറെ സോഷ്യൽ സംഘടനകളൊക്കെ അതിന്റെ മൂവ്മെന്റ്സ് ഒക്കെ വന്നിട്ടുണ്ട്. എനിക്ക് തോന്നുന്നു IMA സ്റ്റേറ്റ് ഒക്കെ ഇടപെട്ട് തുടങ്ങിയിട്ടുണ്ട്. നമുക്കൊന്നും അതിലൊക്കെ ക്യാമ്പുകളോ സെമിനാറുകളൊക്കെ നമുക്ക് സംഘടിപ്പിക്കണം. എന്നാൽ ഇന്നത്തെ ഈ മീറ്റിംഗിൽ വളരെ നല്ല രീതിയിൽ ന്യൂ ഡ്രഗ്സിനെ പറ്റിയിട്ട് ക്ലാസ് എടുക്കുകയും നമ്മുടെ ക്ഷണം സ്വീകരിച്ചു വേണ്ടിയെത്തിയ ഡോക്ടർ വിനായകന് കണ്ണൂർ വളരെ സന്തോഷമായിട്ട് വളരെ നമസ്കാരം. ഒരു കാര്യം മുഹമ്മദ് ഡോക്ടറുടെ ആത്മകഥ പുസ്തകം ഇവിടെ കിട്ടാത്ത സാറ് എല്ലാവർക്കും എഴുതിച്ചിട്ടുണ്ട് ഒന്ന് കലക്ട് ചെയ്യാം.